Can we talk a little bit about grinding? I mean, I can hear my kids down the hall, like 2 rooms away, grinding their teeth, and it drives me insane. Is this bad?
We hear this all the time from parents. They're concerned. They think there can be issues. It's always good to bring it up with your dentist. We always want to know. Grinding can be a normal sign of airway development, or it could mean something more. So we want to know if your child is also snoring. We want to know if they had their adenoids checked out. Usually, if there is an airway issue, which that could point to, we'll make a referral to the ENT and work alongside them to address it.
Okay, so I'm gonna break this down a little bit. So grinding, should there not be anything related, is this a normal, common habit that kids have?
Yes, we see this often and they can outgrow it often.
Okay, so and especially to me, I'm like, "Oh, it's just their baby teeth." Is that like, is it okay?
It is okay as long as everything on the clinical exam looks okay. We wanna make sure there isn't excessive wear. Sometimes we see extra grinders where they're grinding down to the nerve of the tooth.
Ay.
That's usually something we're gonna work with the ENT on because it might point to an airway issue. If we see that in the adult tooth, we might make a night guard, something like that, but usually with younger kids, we don't do night guard because it could be a choking risk.
Okay, but with older kids with adult teeth, night guards are one of the ways to deal with it.
Yeah,
Once everything more severe has been cleared away.
exactly. If it's an indication we're seeing wear on those teeth, it could be a good addition to the routine.
Okay, so I see mouth guards as one really good solution to like the actual physical problems of the teeth. But is there like any way to have them just stop grinding?
I think that's almost like a behavior and psychological question, maybe finding
Yeah.
out the root of what's going on because we see a lot of grinding shoot up in September, which is when the school year starts.
Oh,
So just thinking about life events and what else is going on and maybe approaching it from that angle as well and giving the parents the tools for that.
okay. And so you mentioned breathing and adenoids. That's a lot. So I know a lot of concern about open mouth breathing when sleeping. Can you tell me what the concerns are around that?
Yeah, so with open mouth breathing, I know this is also a big conversation. We ideally want to avoid dry mouth because if we have a dry mouth, we don't have a lot of saliva, and saliva helps protect against cavities. So, closing your mouth, keeping the mouth moist with saliva is protective and good for the teeth. We never recommend taping your child's mouth shut at night. I want to make that super clear. I know
Yeah.
some places on social media is touting that. That's just
Yes. Let's
dangerous.
just say it again. We don't tape kids' mouths shut.
Correct. Correct.
Period.
Correct. Exactly, but with open mouth breathing, there are studies with orthodontics that it could change development of how the face develops, so we could develop a longer face, a little bit hollower of a mid face, but that's in severe cases. I wouldn't necessarily say that's the norm.
Okay, so for the most part, this is not happening to most kids. If they're mouth breathing, I will say as a pediatrician, it's very common if they're stuffed up and have a virus and can't breathe through their nose, which have to open their mouth to get oxygen in and breathe. And then if this is a really big, a habit that's more generalized than that, is the first place to start going to your dentist?
I think going to both your pediatrician and dentist and then possibly going to ENT would be the next feasible step, but making sure
Mhm.
you go through all the options, and like you said, we see this come up all the time during allergy season too.
Okay, and so, like, when it comes to the adenoids, how is all that related? You think that they're when you refer them to the ENT, which is ears, nose, and throat doctor, what are some of the things that they do?
So they'll always do an evaluation. They want to look at the tonsils and the airway to make sure it's clear. They may keep an eye and monitor, see if the child outgrows as the airway develops and matures, or they may plan for the tonsils to be taken out or shaved down. There are a range of options.
Okay, so all really depending on the root cause of it and what's the best thing in
Yes,
the big picture. Yeah, makes sense.
exactly.